All righty. Good morning, everybody, and thank you for joining us for the July Tennessee SHIPSMP Volunteer Update Webinar Series webinar. Today I'm going to be talking to you about some tips on how to counsel on the differences between original Medicare and a Medicare Advantage plan. So we're going to have a lot of unique discussion about this. The big thing that I really want to start off by saying is every single person on this webinar, every staff person, every volunteer is going to have a different style on how to counsel a Medicare beneficiary. And it's important for all of us to know that there is no right or wrong way to counsel somebody, as long as you understand the materials that you're presenting. So we're going to go over in a little bit my style of how to counsel people. That is probably going to be completely and totally different than your style of counseling someone, and that's fine. You may pick up some of my tips. I may pick up some of your tips. So feel free to ask questions along the way. And another important thing to really be aware about when you're counseling someone is to be adaptable. I have my way of counseling, but there are many beneficiaries who do not understand a word I'm saying when I talk about my style of counseling. So I have to be able to adapt to help my beneficiary understand what I'm saying. So we may have to say things 2 or 3 different kinds of ways, even though they mean the exact same thing, just to help that beneficiary understand what's going on. And probably the most important piece of advice I can give everyone is don't be afraid to ask questions. And what I mean by asking questions is not only asking other volunteers or other staff people if you have questions about what the volunteer needs, but don't be afraid to ask the client themselves specific questions. We never want to assume anything about a client, as we're counseling them on Medicare. We need to know all the details of everything that client is going through when it comes to their health insurance. I keep saying important tips, but this one is by far the most important. A million times over, as a SHIP staff person and volunteer, we must remain non-biased. What that means is our personal opinions of what is best for the Medicare beneficiary does not matter. We give them the information, and it is solely up to that Medicare beneficiary what insurance they feel is best for them. We give them all the facts. We can give them all of the numbers, but it is not our decision as SHIP staff and SHIP counselors what that client should enroll into. I really want to stress this, and I'll be stressing it again throughout the entire presentation, that non-biased counseling is key to the success of our program. SHIP is kind of being known nationwide as being very biased and very anti-Medicare Advantage Plan. So I've kind of been going around to all of our volunteer groups and really hitting this home to everybody this year that that's not who we are. We counsel everyone on every health plan option and get all the correct, most up-to-date information that we have available and give it to that client to make an educated decision about their health care. So please, please, please remember, if you start feeling that twinge of, ooh, you don't want this, that is not for you to tell the beneficiary. It is for them to decide and for us to give the facts. And I'll kind of show you how I do that through my counseling style. But before we get to my counseling style, for every single new Medicare beneficiary, there are some really, really important questions to ask them before you even get into the discussion on do you want original Medicare or a Medicare Advantage plan. The first major question to ask all of your clients who are new to Medicare is, do you currently have insurance through an employer, or does your spouse currently have insurance through an employer that you're covered? Why is this important? Because it's going to determine if the beneficiary even needs Medicare yet. We know from initial training, and I know it's been a little bit of time for some of you who've been to an initial training, but that's okay. If I have current employer insurance that is credible, now credible is another conversation, and we actually talked about credible coverage back in May when we did a webinar on coordination of benefits. So if you weren't on that one or want some more information, go back to our YouTube channel and look at that May webinar. But credible coverage means that your coverage is as good or better than Medicare. And in terms of employer coverage, it means you are actively currently working. The keywords there are actively working. If that's the case, then we have to figure out what kind of insurance that beneficiary has through their employer. Is it a regular insurance plan where you go to the doctor and have copays, or is it a health savings account, or kind of what kind of structure is it? And in many cases, we're seeing more and more health savings accounts, but in many cases, the beneficiary may not need their Medicare Part B as in boy or their Medicare Part D as in drug because their current active employment or their spouse's current active employment is credible, so they don't need Medicare just yet. So we're not going to get into a scenario like that, but just know that that's a very key question to ask the beneficiary at the start of the conversation. Another key question to ask is, are you or your spouse a retired military service member? Now, when I say retired military service member, that means they've had 20 years of service or more and are considered a retiree of the military. So not necessarily well, we'll talk about that too. So if they are a retired military service member, they could be eligible for TRICARE for Life. And again, kind of going back to your initial training, TRICARE for Life pays the 20% Medicare doesn't pay, along with helps with prescription medication costs. So all the beneficiary would need is Medicare Part B as in boy, and then TRICARE would pay for the rest. It's amazing coverage, and all of our retired military servicemen and women deserve that coverage, so we want to make sure we ask that question. If you come across a military service member who is not retired but gets health care through the VA, that's a different scenario. The VA and Medicare do not work together. So a beneficiary could go to the VA hospital and get care, or they could go to a civilian hospital and get care. They're not going to work together unless the VA gives that service member permission to see a provider outside of the VA. So it's important when someone says, I have VA coverage, but they're not a retiree of the military, that they still enroll into Medicare Parts A as in apple and B as in boy, so they can get coverage at the VA, or they can get coverage at a civilian hospital in case there's not a VA hospital around.
Is the phone number you're calling from?
Okay. And again, feel free to ask questions and type questions in as I go if you're getting confused. The third and final question that I ask beneficiaries before any discussion about original Medicare and a Medicare Advantage plan happens is, are you currently enrolled into the Affordable Care Act marketplace? Some of you may have heard it be called Obamacare. When you have your SHIP hat on, please call it by its actual name, the Affordable Care Act or the Patient Protection and Affordable Care Act or the marketplace. All of those are kind of interchangeable, but we try not to use any slang terms when it comes to the actual name of the healthcare insurance. The reason why this question is so important is because the Affordable Care Act marketplace plans are not considered credible coverage with Medicare. So the beneficiary, if they're enrolled into one of those plans, they need to disenroll into that plan before they start Medicare, and then Medicare is going to be their primary insurance. There are some benefits of the Affordable Care Act depending on your income. You may be able to get tax subsidies to help pay for premiums, or you could get some cost-sharing reductions based on your income. Once you qualify for premium-free Part A of Medicare, all those benefits go away. So you don't get that premium cost-sharing, or excuse me, the tax subsidies for your premium and the cost-sharing reductions. You would be paying 100% for your Affordable Care Act plan. So Medicare would then be the more cost-effective option. So please, before you talk to a new beneficiary, please list and ask them those 3 questions. Like I said at the beginning, you're probably going to be asking the beneficiary more questions than the beneficiary is going to be asking you, and that's okay. Some important questions to ask a retiree who's going on Medicare. So this means that they're already age 65, they've had that employer coverage, and now they're retiring and going on Medicare. There's a few important questions to ask there as well. The first one is, when does your employer insurance end? Not what your retirement date is. That's what a lot of people want to tell us is, oh, I'm retiring on June 15th. Great, I'm happy for you, but what I really need to know is what date is your employer insurance ending. That's going to determine when our Medicare needs to begin, or their Medicare. So, for example, I have a coworker who was retiring in June, but her Medicare, or excuse me, her employer insurance wasn't going to end until August 31st. So her Medicare needed to begin September 1st and not sooner, or else she'd be paying for a premium for insurance that she already had. So that end date of the employer insurance is very, very important. We also need to ask them if their employer offers any coverage for their retirees. So this is very prominent when it comes to federal employee health benefits, if they offer retiree coverage. If you talk to any state of Tennessee retiree, that could be state government, it could be teachers, it could be local government. There's a lot of people mixed into that state of Tennessee retiree. They have a special Medicare supplemental retiree plan called POMCO. So it's very important that we ask what company they're retiring from to see if we know of any retiree coverage. And we also have a lot of other organizations who have their own specific retiree insurance coverage once the beneficiary retires. And it gets a little tricky. 10, 15 years down the road, that person's retiree coverage could go away. So it's one of those things that if they have retiree coverage, depending on what it is, they may not need other parts of Medicare in addition to that retiree coverage. And then again, we always want to ask the beneficiary if them or their spouse was a retired military service member. And we already kind of talked about the TRICARE option. So those are the main questions to ask new to Medicare beneficiaries and retired Medicare beneficiaries. So I'm going to open it up and see if anyone has any questions. Oops, as I accidentally moved that forward. So I'll open up to the floor, or I haven't seen any questions come into the chat box. So if anyone has any clarifying questions, now's the time to ask. All right, so we're going to move right along. And we're going to talk about my style. And this is many people's style. I didn't coin this style. I just like to call it the style that I do. So this is my style. And I'm going to talk about two different ways. I'm going to talk about how I counsel people over the phone and how I counsel people in person. So we're going to get both of those sides. Oh, let's see. I did have a question come in. What about civil service retirees? Can you elaborate on what you mean by civil service? So that could mean a lot of different things. And I'll come back to that question here. Oh, federal employees. So I can't go into any details necessarily about federal employees, but they do have retiree insurance options, and there's more than one, so that's why I can't go into a whole lot of detail. But it's important to look at that retiree coverage. It's excellent retiree coverage, and they would have to talk to their human resource agency to see if they need Medicare Part B. A majority of the time, federal employee benefits do need Medicare Part B, and then their federal retiree insurance covers everything else. So a lot of research goes into the federal retirees. And we talk about that, like I mentioned earlier, on the May webinar. So you may want to go back to our YouTube channel and look at those. Follow-up question, if the insurance goes away later, will they be penalized to get Medicare? With retiree coverage is not considered credible. So people who are offered retiree coverage should get Medicare Part B as in boy, because Medicare is going to be primary. Retiree coverage is always secondary. So they will not get penalized if they have drug coverage through their retiree coverage because drug coverage through retiree services are credible. So they should have that Medicare Part B. Another question came in. If they have POMCO, what part of Medicare will they not need? Or is it dependent on each case? What kind do they get through POMCO? Is it all different? Okay. So POMCO is a state of Tennessee Medicare supplemental plan retiree coverage, or a Medigap plan. And I don't have the chart in this presentation, but there's 10 different coverage levels, and POMCO is the equivalent to a plan D as in dog for the coverage. So it covers everything but the Part B as in boy deductible, which is $183, and it does not cover a Part B excess charge. And that's all that POMCO does, is it covers the hospital and medical, the 20%, so to speak, that original Medicare does not pay. POMCO retirees do need to enroll into a Medicare drug plan. POMCO does not cover any drug costs. When you get on POMCO, you have to have Medicare Part A and B in order to get POMCO, so you won't be charged any penalty because you'll have all of the insurance that you need. So you have to have A, B, and a drug plan when it comes to POMCO, and POMCO covers the 20% Medicare doesn't pay for A and B. And we also had a follow-up question, what's an excess charge? That's a great question. An excess charge, which is what I was talking about when I said what POMCO did not cover, was the deductible and the excess charge. The excess charge can be issued to a beneficiary who goes to a provider that does not accept Medicare or wants to perform a service or procedure Medicare does not cover. If that happens, they have to sign an advanced beneficiary notice of non-coverage, or an ABN, and then if they sign it, then they agree to pay an extra 15% in addition to the 20% standard payment that they would have. So they'd have a 35% coinsurance for that service or procedure. And on that advanced beneficiary notice of non-coverage, it tells them what the cost is going to be, why it's not being covered, and things like that. So they'll know step by step on if they want to take that service or not. I had another comment come in. I had a beneficiary who insisted on disenrolling from Part B because she was covered under her retiree coverage, federal employee retiree coverage. Will there be any financial repercussions for that? If the federal retiree coverage goes away, possibly, because she doesn't have Medicare Part B and the retiree coverage is not considered credible. So if she ever lost her retiree coverage or for whatever reason decided to not enroll into retiree coverage anymore, she would get penalized for not having Part B. And the Part B penalty, again, going back to our initial training, is 10% for every 12-month period you were eligible but did not enroll. So possibly, most likely, federal employees are not going to be disenrolling from their retiree coverage anymore, or ever. They'll keep it as long as it's available to them. Great. Excellent questions, everybody. So I'm going to keep typing in your questions, but I'm going to continue on in the presentation so we can go back if something comes to you that you want to ask. So again, this isn't I didn't coin this style, but this is the style that I use. And I encourage you who are listening on the webinar today, or if you're listening via YouTube, I encourage you to follow the steps that I'm about to take, or have you take. So it's like you're the beneficiary on the phone with me. I want you all to get out a blank sheet of paper. And what I want you to do with that blank sheet of paper is I want you to fold it in half. Doesn't matter which way you fold it in half. It could be hamburger style, hot dog style, whatever you prefer. On the left side of your paper that you just folded, oops, wrong way. Sorry. I want you to title the left side of your paper Original Medicare. And I want you to title the right side of your paper Medicare Advantage Plan. So we're going to talk about both of them. Not for any particular reason, not because I I like one option over the other, but original Medicare is on the left, so we're going to start talking about original Medicare first. And always, when you're talking to someone on the phone, are you ready for me to continue? Am I talking too fast? That kind of a thing. Make sure the beneficiary is on the same page you are. The first thing I want to tell you about original Medicare under that column is its nationwide coverage. And to elaborate a little bit on what I mean by nationwide coverage is you'll be able to go to any doctor across the country and in the U.S. territories that accept Medicare assignments. All hospitals across the country are mandated by law to provide you care. They cannot turn you away. So that's a little bit of an elaboration on the nationwide coverage. The next thing is you will use that red, white, and blue Medicare card that you got in the mail from Social Security. That's going to be your primary insurance card for your hospital and your medical. So anytime you go to the hospital or see a doctor, that's the card that you're going to give them. It's also, original Medicare is an 80-20 split, meaning Medicare pays 80% and you're responsible for 20% of any kind of cost. Now, there are deductibles and things like that included in the 80-20 split that we can talk about later, but generally just to keep the beneficiary not overwhelmed, just stick with the 80-20 split. You're also able to get drug coverage to cover your prescription medication. And I can do a comparison for you to help you find that most cost-effective drug plan. We use the Medicare.gov website, and all I'll need you to do is fill out a worksheet for me, and I can do that comparison for you very quickly. So I can get you that information if you're interested. If you decide to pick a drug plan, that's going to be the second card in your wallet. So you have your red, white, and blue card that you take to the hospital and to the doctor, and you're going to have your drug card that you only take and show to the pharmacist. You're also able to get a Medicare supplemental plan. And what a Medicare supplemental plan does is it covers the 20% Medicare doesn't pay when I told you about that 80-20 split. Now, there's a lot of different coverage levels. There's actually 10 different coverage levels. So what I want to do is send you, in addition to that worksheet to do your drug plan comparison, I also want to send you a chart that details all of that coverage so you can see and pick what coverage level you would like. And I can also, we have a system that we use to be able to do a supplemental plan comparison so I can give you some premium quotes on how much that supplemental plan may cost. It's also going to be the third card in your wallet. So this supplemental plan card is what you give to the hospital and your doctors in addition to that red, white, and blue Medicare card for your full coverage. And the last thing on original Medicare is they don't offer any dental, vision, or hearing coverage, with the exception of a few things, like you can have cataract surgery and things like that. But anything routine, like cleanings, x-rays, regular vision exams, if you go for specific exams like glaucoma and stuff, Medicare will cover that. But anything just kind of preventative, original Medicare doesn't cover when it comes to dental, vision, or hearing. And that's the information I give to the beneficiary. Of course, then I ask, do you have any questions about what we've discussed so far? It's a very broad overview, and we'll get into more detail later, but I just want to make sure you understand the broad overview of original Medicare. Then the beneficiary will either ask you questions or they'll say, okay, no, I understand. So I cleared some things up. And I say, okay, now we're going to look on the right side of the paper that I had you fold in half, and we're going to talk about a Medicare Advantage plan. Medicare Advantage plans have networks of providers you have to stay in. It could be a very strict network of providers. It could be a wider network of providers. It depends on what kind of plan you enroll into. So when it comes to an Advantage plan, it is extremely important that you contact all of your doctors, hospitals, specialists, anyone that you get your care from. You have to do your homework and contact those providers to make sure they accept whatever Medicare Advantage plan you decide to enroll into. So it's not nationwide coverage like original Medicare. You have to really look at that network of providers. You also use the company card that you enroll with So you're not going to use that red, white, and blue Medicare card that Social Security sent you, but you want to keep a hold of that. Do not throw it away. You don't necessarily have to carry it around, but make sure you know where it's at, and you want to keep that red, white, and blue card. Do not throw it away. You also have set co-payments for services that you need. So, for example, you might have a $10 copay to see your primary care doctor, a $30 copay to see a specialist, $300 for days 1 through 5 in the hospital, something along those lines. You also, on a Medicare Advantage plan, have an out-of-pocket spending limit. So you do have a maximum amount of money that you'll pay out for copays for your services. And the maximum out-of-pocket spending limit in 2018 is $6,700. So that would be the most you would pay out of pocket for a Medicare Advantage plan in terms of the copays for your hospital and your medical. And there are other plans that are out there that have a lower out-of-pocket spending limit, but that's the highest. Plans, if you have drug coverage and need drug coverage, the Medicare Advantage plan has that included. And just like with the drug plan, I can do a comparison for you to get you more detailed information about the Advantage plan. Happy to do that. It's also, one of the big things with the Advantage plan is it's illegal to purchase a Medicare supplemental plan if you want the Advantage plan. So you're not going to be able to get supplemental coverage to cover those copays. You're going to have a copay for the services that you need. Advantage plans may have additional benefits. So they may have some dental, vision, hearing services, silver sneakers. Some may have transportation. So they may have some additional benefits that original Medicare doesn't. Just starting off on a Medicare Advantage plan, they usually cover the preventative services. So if you were looking at more comprehensive dental care, we would want to look into the Advantage plan to see if they have a more comprehensive plan, probably for an additional premium. So the basic benefits is mainly preventative benefits for the Advantage plan in dental. And we would contact the plan directly to get more details about those additional benefits. And that's an Advantage plan. And I would ask the beneficiary if they had any questions on that. And again, very broad overview. When it comes to counseling over the phone, for me anyway, very rarely, if ever, do I do all of the counseling in one phone call. There has to be at least 2 to 3 phone calls when you're talking to me before I enroll you into any plan, original Medicare or an Advantage plan. Open enrollment, or excuse me, the annual enrollment period, October 15th through December 7th, that's really the only exception to that rule, because sometimes you may have a deadline. They're going to call you on December 6th when their deadline is December 7th, so that might be a one phone call conversation. But when it comes to a new Medicare beneficiary, it's going to be at least 2 or 3 phone calls, personally with me. And as I just went over that counseling style, I do keep things very general because I don't want to overwhelm the beneficiary. Too much information is just going to confuse the beneficiary and cause a whole lot of frustration, and they're just going to give up. So keep it as general and as broad as you can, and then once the beneficiary decides, oh, I think that Medicare Advantage plan option is for me, or I really like the original Medicare option and the flexibility, that's when you get into more of the details. Okay, well, I'll do that comparison and find out what your premium is going to be for the drug plan and what your copays for your medicines are. I'll get you that premium estimate for the supplemental plan or the Advantage plan, and I want to make sure that we get you enrolled in whatever plan you're interested in at least 1 month before you're eligible for Medicare. So we can kind of do the deadlines and the costs and the comparison. Every single person that you talk to, especially on the initial call or the initial face-to-face, always screen them for the low-income subsidy, extra help, and the Medicare Savings Program services, those QMB, SLNB, and QI1 programs. When I screen for LIS or MSP, the only thing I ask is, has anyone ever screened you for these services to help you pay for your Medicare costs? They say no. I say, do you make less than 1,000, I can't remember off the top of my head what the low-income subsidy limit is. It's 1,500 something. So
1,518.
Thank you very much. I knew somebody would know it. Do you make less than $1,518 in 1 month before any deductions are taken out? And they'll say yes or no, and if they say yes, then I can get into that application process with them. If they say no, okay, just check the box off on what you counseled the person on. And then at the final call, after you've done the enrollment, so this could be the third or fourth call that you've done with this beneficiary, remind them about October 15th through December 7th is the annual enrollment period, and we can reevaluate your plan and see if there's anything cheaper for the next year. So it's a longer process when I counsel someone over the phone, but I want to make sure, especially when it comes to those comparisons, that I'm able to do the print-off, and then I'm able to send it to the beneficiary so they can see what I'm seeing. When it comes to numbers, people get very confused as they're trying to take notes and you're telling them different numbers for different things. If they have that comparison in front of them and they can see exactly what you're seeing, and you say, on page 1, about a quarter of the way down, you're going to see what your premium amount is, and I highlighted it for you, and things like that, and kind of guide them through the comparison. It really, really helps the beneficiary understand what you're talking about. All right, any questions or comments about how I counsel someone over the phone? And again, you're going to have your own counseling style, and that is perfect. I encourage you to learn a lot of different counseling styles. Don't necessarily adopt everything that I just told you, but you may have picked 1 or 2 things like, oh, I don't remind everyone after I talk to them about open enrollment, or, oh, I really need to do better at screening every single person I talk to about low-income subsidy. Okay, let's see. We had a question come in. Where do you find the comparisons for supplemental insurance? Tennessee SHIP has purchased a comparison tool through CSI Actuarial. And actually, if you look on the YouTube channel, it's in one of 2017's webinars, we did a tutorial on how to use the comparison system. So if you want to look, archive back on that. But only SHIP staff and volunteers are allowed to get access to that, so it's not a public site like Medicare.gov is. So if you wanted to request an account for that site, feel free to shoot me an email and I'll send you the link, and you can register for an account for that supplemental comparison tool website that we have. Great question. Alrighty, any other questions on how I counsel somebody over the phone? Everyone's probably like, I do that already, and that's okay, that's great. Alrighty, so I'm going to move on to how I counsel somebody in person. Now, in person is a lot different than when someone is over the phone, because you hopefully will have access to a computer, maybe a printer, so you can kind of go over some things with that person in person. So you all remember this chart. This is my favorite chart. We talk about it at initial training all the time. I like to look at Medicare in pictures. It helps me stay organized and helps the beneficiary kind of understand the process. And it's another reason why when I tell beneficiaries on the phone to fold the paper in half and original Medicare is on the left, because this is how Medicare prints their organizational chart. So I just keep everything kind of how Medicare has it printed in their books, like the Medicare New Handbook and the Medigap Supplement, how to choose a Medigap policy guide. So this is the picture that I like to show people. And I explained just like what I did earlier on the phone. Here are the differences between the two. So I'm not going to do that again. But what I do when I'm in person with someone is I actually go through the boxes and I write in the premium amounts for that person in the box. So for 99% of our Medicare beneficiaries, their Medicare Part A is going to be free because they've paid into the FICA tax or the Medicare tax for 10 years or more or 40 or more quarters. So they're going to have a premium-free Part A. You may run into a person who has to pay a premium for Part A, and we can talk about that at a different time, and I can kind of explain how to counsel someone in that situation. Then I tell them their medical insurance Medicare Part B, the premium in 2018 is $134. Now, we also have to ask the question for IRMA, the Income-Related Monthly Adjustment Amount. That's what IRMA stands for. I just didn't have enough space to type it all out. So again, it's Income-Related Monthly, Income-Related Monthly Adjustment Amount. It should be, sorry, ARMAA. That's how IRMA should be spelled. I apologize. I did the acronym wrong. Income-Related Monthly Adjustment, there should be an A instead of an M, amount. And what that means is if you make a higher amount of money 2 years ago, so they look 2 years back at your tax return, so in 2018 they look at your 2016 tax return, and if you make over $85,000 as a single individual, over $170,000 as a married couple, your premium is going to increase based on whatever amount you filed for your taxes 2 years ago. And we have charts and everything about what those different coverage, those different premium levels are depending on that income. So I can send that out to anyone who's interested, or it's in a lot of your initial training manual stuff as well. But a majority of people that we talk to are going to be within that $134 range. You may come across a few who are higher than that. And then we can do a Part D comparison because we're in person with that individual. We have a computer. We may have a printer. If not, we can huddle around the computer. But it's based on the comparison results. So I can't tell you if you say, hey, my dad's going to enroll in Medicare, what's his drug plan premium going to be? I have to get a lot of information from him or from you before I can determine that. I need to get the medications that he's taking. I need to get all of his Medicare information so I can plug it into Medicare.gov. So for the sake of our example, again, this is just an example. It's not going to be for everyone. But for our example, we're going to have a premium of $17.70. Just as an example, again, do that comparison. That number is going to be based on the comparison results that you do for your individual client. Then I can also do the Medicare supplement insurance comparison on that website that I mentioned a little while ago. Again, if you want an account set up, shoot me an email. I can get you the link to do that account. But you do the supplemental comparison, and we'll say, for an example, they wanted a plan and the premium was going to be $114 a month for that supplemental plan. Again, the supplemental plan covers the 20% Medicare doesn't pay. So just in my chart, I give them a total of $265.70 a month, but that does not include the copays for your medicine and any possible costs you have depending on what Medigap coverage you choose. So this chart, I really just fill in the premiums so they can understand the financial portion of their Medicare decision. And then I say, do you understand that? They do. I do the same thing for a Medicare Advantage plan. So even if you enroll into a Medicare Advantage plan, this is a common misconception among many, many of our beneficiaries is, I want an Advantage plan so I don't have to pay my Medicare Part B premium. That is not true. You still have the Medicare Part B premium, the $134 to pay if you enroll into a Medicare Advantage plan. You still have that Part B. And then we do a comparison result. There are many plans in Tennessee that have a $0 premium, so that tends to be a very popular plan. We also have plans in Tennessee that can range up into close to the $200 a month range. So depending on the comparison results is what the premium is going to be. And for my example, I just said that we enrolled into a $0 premium plan. As we counsel beneficiaries on Advantage plans, we want to make sure that we look for plans that have drug coverage because we don't want to possibly issue or have the beneficiary be subject to a penalty if they don't have drug coverage. And there could be plans that have no health premium but have a drug plan premium. So again, it varies plan by plan. We can't tell someone just off the street what's your Medicare Advantage plan premium going to be. We have to say, I don't know, I need more information, and then I can tell you for sure what your costs could be depending on what they enroll into. So for the sake of our example, we're going to say that their drug plan premium was free as well. So I tell them that their total monthly premium is $134, But another thing that's extremely important to tell them is what their out-of-pocket spending limit is going to be for that Medicare Advantage plan. So you'll have $6,700, like I said, is the maximum. However, depending on whatever plan you enroll into, it could be lower than that. Again, depends on the plan and what comes out of the Medicare.gov comparison tool. And it does not include the copays for your hospital, medical, or prescription drug coverage. So you're going to have those copays that they have to consider as well. So looking at these two, on original Medicare, you really pay more monthly and less out of pocket, depending on what supplemental plan you get, of course. And on Advantage plans, you pay less monthly, but possibly more out of pocket, depending on your health care needs. Medicare is not a one-size-fits-all for beneficiaries. And this is extremely important as to why we, as SHIP staff and volunteers, have to remain non-biased. We're not able to say, oh, the original Medicare plan is way better for you than that Advantage plan. That should never, ever, ever come out of our mouths. If it does, call me, we'll talk about it, and hopefully it won't happen again. So this is the education piece that we give the beneficiary, and this is what they decide, or how they decide what kind of Medicare insurance they want. I have not influenced them one way or the other. I have simply given them the facts. And then whatever plan they want, they say, I want to enroll in this. I say, okay, and I click that enrollment button if I can. Especially with Advantage plans, after they do their homework and tell me that their doctors and hospitals and all their providers accept that Medicare Advantage plan. Okay, let's see. We had a question come in. Is there any chance getting phone numbers for the companies on the supplemental tool? No, because it's not our system. So unless CSG changes their policies, we have to go with the insurance company list from the Department of Commerce and Insurance to get the phone numbers for our beneficiaries. So unless they change their system, it's not going to be added, unfortunately. So a couple things to keep in mind when you're counseling someone in person. It's very possible that you might have to do a follow-up call or appointment. I do follow-up calls or appointments if someone needs to enroll in that Advantage plan, again, to make sure that they do their homework and have called their doctors, hospitals, specialists, all that good stuff to make sure that they're going to be able to see their providers when they enroll in that Advantage plan. It's not me saying an Advantage plan is bad. It's me doing my due diligence to make sure that that's good coverage for that beneficiary. And again, the annual enrollment period, October 15th through December 7th, is a possible exception to be able to get them enrolled by the deadline. Some different things that may happen on the initial appointment than we did over the phone is the client may or may not pick an option. However, we're able to complete the comparison in front of them, fill out the charts, give them some information to look over and take home to digest more than what we're able to necessarily over the phone. We'll have to mail them all that information so they have it, where this way they can just take it home. So kind of sort of one less step when you do it in person. And then again, always screen for those low-income programs, the low-income subsidy or extra help and the Medicare savings programs, the QMB, SLMB, and QI1 services. And then again, always remind them annual enrollment period between October 15th and December 7th of every single year. We had another question come in about the Medicare supplemental tool. I didn't realize that was going to be so popular. If you've forgotten your username or password, can you recover them? Yes, you just have to go to the website and reset your password. And if you don't know the website, shoot me an email. I'm happy to get that out to you. So any questions on how to counsel or any other suggestions that I may not have mentioned that you want the group to know about counseling an individual in person over the phone? Always open to suggestions from other people. I can always improve my counseling skills and make it better, so I like constructive criticism if it's out there. Notice I said constructive criticism and not just criticism. All righty. So this is where I ask for questions. If you have a question and want me to unmute your line, feel free to raise your hand. Gosh darn it. Sorry. Keep doing that wrong. And I can unmute you, or anyone. You can type in questions at any time as well about how to counsel. So the next thing I want to talk about that I'm probably going to get quite a few questions about, this is where the high influx of questions will come in, is we've gotten a lot of new important updates for 2019 already. So we're going to talk about 4 of them. And you can see what they are on the screen. I'm going to, okay. When it comes to Advantage plans, how do you advise people on a PPO versus an HMO? So sorry, going back to counseling real quick. So when it comes to Medicare Advantage plans, in Tennessee, we have 3 main types of plans. We have an HMO, a health maintenance organization. We have a PPO, a preferred provider organization. And we have an SNP or SNP, or a special needs plan. Now there's other plans that encompass those as well, like HMO POSs and things like that. So those are the 3 main types. So the big difference is our HMOs, this is how I always say it in initial training, and people probably get annoyed with me by it. But do me a favor and visualize a dartboard. Everyone got that picture in their mind. An HMO is going to be the most restrictive on the doctors and providers you can go to. They have a very tight network, and many of them, not all, there are exceptions to just about every rule, but many of the HMO plans, if you go outside of that network, you have to pay 100% of the cost of that service. So it's very, very important that you stay within that network of doctors in the HMO. PPO, you can go outside of that bullseye. So the bullseye is going to be your network of providers. With the PPO, you can kind of go outside of that bullseye to where you're able to stay in the network and pay the plan's designated copays, or you can go outside of the network and have a higher coinsurance but still are considered covered. So there are 2 plans I can think of off the top of my head. They range anywhere from 40% out of pocket or out of network costs to 50% out of network costs. Again, a little bit more flexibility. However, in order to pay those copays, you really need to stay within that network of providers. And then we also have the special needs plan, which is only for individuals who have Medicare and Medicaid. And a follow-up question came in, should we advise people away from an HMO towards a PPO? Absolutely not, because that means we are biased. Do not do that. We cannot steer or sway anyone in any direction. All we can do is say PPOs are more restrictive, HMOs are more restrictive, PPOs can give you a little bit more flexibility. As long as the doctor accepts the plan that the beneficiary is enrolled into, and they can enroll in whatever they want to. But they have to do that homework. We can't steer them one way or the other. Now, when we do a comparison, it could be HMOs that come up as their most cost-effective, and a PPO could be $2,000 more a month. So in that way, when it comes to the comparison results, you may see HMOs pop up more or PPOs pop up more, but we don't want to steer them one way or the other. Oh, sorry, I thought I had another question. All right, any other ones before we move on? And I hope I answered that question without being too mean. All right, so here are the 4 new updates for 2019. The first one, we have some new vocabulary. And I had another question come in, and I'll address that in a minute, I promise. But this is extremely important. So if I have lost you in the webinar and you're like, oh, she's going to talk about counseling, come on back to me because this is extremely important information to know. We have new vocabulary we have to learn, and we need to start learning it early because we're used to calling things many different things. So we now need to refer to October 15th through December 7th as the annual enrollment period, or AEP. We used to be able to interchange that with open enrollment. We need to stop doing that. we need to start calling it from the annual enrollment period, October 15th through December 7th. What you can do during those dates has not changed. You can still, this is the time where you reevaluate your drug plan and Advantage plan and try and get something cheaper. That part hasn't changed. The only part that has changed is we want to call it the annual enrollment period. Why? Because we are now starting January 1st, 2019, we are starting the Medicare Advantage Plan open enrollment period. So hence why we're stopping calling it open enrollment, because we don't want to confuse these two dates. Again, annual enrollment period has not changed, October 15th to December 7th. New, well, not really new, it's coming back. This started in 2011, I believe. I'd have to double check that. But now it's starting up again. The Medicare Advantage open enrollment period is January 1st through March 31st. And I'm going to tell you exactly what that means. So what this means, I've kind of given you a key down here at the bottom. When you see MA, that means Medicare Advantage Plan. When you see PD, that means Part D. When you see OM, that means Original Medicare. It's just easier than me typing a whole bunch of stuff out. So your key is down in the right bottom corner. So during this time, January 1st to March 31st, a beneficiary is allowed to change from a Medicare Advantage plan with a drug plan to another Medicare Advantage plan with a drug plan, to a Medicare Advantage plan with a drug plan, to Original Medicare with a drug plan, to Original Medicare with a drug plan, to a Medicare Advantage plan with a drug plan, to a Medicare Advantage plan only plan, to a Medicare Advantage plan only plan. That means the Medicare Advantage plan does not have drug coverage, so an MA plan only. A Medicare Advantage plan only to Original Medicare only with no drug plan, or Original Medicare only to a Medicare Advantage plan only, again, with no drug coverage. That's what the beneficiaries can do between January 1st and March 31st, starting in 2019. The only thing, and I didn't put this up here because I don't want to confuse you guys, but I do want to tell you, the only thing that a beneficiary cannot do is go from an Original Medicare drug plan to an Original Medicare drug plan. That is not allowed. These 6 scenarios listed on the screen are the only 6 scenarios that can happen during the Medicare Advantage open enrollment period, January 1st to March 31st. This is new. It's starting soon. Does anyone have any questions on it? Okay. Oh, I'm hearing rumble. Yes.
This is Doug Dillon. I may have missed that. So now, can they go ahead and select during the annual enrollment period a Medicare Advantage plan to start January 1, or must they wait till January 1 to select their Medicare Advantage plan? They can select a Medicare Advantage plan still February, January 1 to February 14th. Now, I may have missed that when you may have covered that, and if you have, I do apologize. Thank you.
Not a problem. It's always good to reiterate. So to answer your first question, yes. You can change to a Medicare Advantage plan during the annual enrollment period, October 15th through December 7th, for your new plan to begin January 1st. To address your second question, the January 1st to February 14th time frame that used to be called the Medicare Advantage Plan disenrollment period is going away. That is no longer an option. The Medicare Advantage open enrollment period is replacing that disenrollment period and giving beneficiaries more options on how to change their coverage. Great question. Oh, I had one come in. So the only difference between open enrollment and Medicare Advantage open enrollment period is not being able to change drug plans. when does the Medicare Advantage Plan open enrollment become effective? Sorry, I may have missed the answer. No problem. So yes, so the first question, that is true. The only difference is you can't go from drug plan, original Medicare with a drug plan to original Medicare with a drug plan. You are absolutely correct in that. And the Medicare Advantage Plan open enrollment becomes effective January 1st, 2019. So it's coming up. We were just as surprised as you guys that this was happening. We saw the new Medicare and U handbooks, and we're like, oh, well, this is different. Great question. Adrienne, it looks like your hand is raised. Feel free to talk at me.
Okay, thanks. All right, so for those who sign up during the Medicare Advantage enrollment period, so say someone signs up in January, is it effective February 1st?
Yes. So it's going to be effective the month after they complete their enrollment, is my understanding.
Okay. And then so second question. Oh, sorry.
Yeah. Okay, go ahead.
Second question. So now if someone is signed up during the annual enrollment period in fall, and then for whatever reason they're not happy, so it's now this is winter and spring, the open enrollment, are the ones who signed up, they can switch even though they just signed up in fall?
Correct. As long as they're not trying to go from original Medicare with a drug plan to original Medicare with a drug plan.
Okay. Thanks.
Yep, they kind of have two time periods where they can change their insurance starting in 2019, provided they fit into one of the 6 scenarios listed on the screen right now. Great question. There was another question that was commented in. Anyone can still apply for LIS any time of the year, correct? Yes, you can still complete the low-income subsidy or extra help application year-round. There's no cutoff dates for that. How are people going to be informed about the Medicare Advantage open enrollment period? Should we start informing people about it when we counsel them? Yes. I think the more people are aware, the better. It's going to be very prominent in the new Medicare and U handbooks that come out in the fall. I don't think we're going to get a huge influx of calls this first Medicare Advantage open enrollment period because it's going to be brand new. But I can anticipate in the next 2, 3, 4 years that this time frame is going to be just as crazy almost as open enrollment. So we're going to have about 6 months of a lot of beneficiaries calling asking for comparisons instead of just our 45 days. That's my personal, my personal opinion, not fact, personal opinion. Let's see. Question came in. So the AEP, the annual election period, is only for Part D sign-up or changes, and you can change from supplemental plans to another, or have I missed it? That is actually not correct. So during the annual enrollment period, October 15th through December 7th, you can do whatever you want to do. It is a free-for-all with your drug plan. You can go from original Medicare to original Medicare to a Medicare Advantage Plan, Advantage Plan to Advantage Plan, Advantage Plan to original Medicare. That has not changed. Open enrollment, see, new vocabulary, I can't even get it right. The annual enrollment period, October 15th through December 7th, has not changed. You can still do whatever you want to do during that time frame. When it comes to supplemental plans, there is no annual time to change your supplemental plan. Those have a lot of different rules. You have the first 6 months that you're enrolled into Medicare Part B, as in boy, to purchase a supplemental plan with no medical underwriting. After that, you'll be subject to medical underwriting and may not be able to change your supplemental plan. So supplemental plans or Medigap policies, those are completely different than the annual enrollment period and the Medicare Advantage Plan open enrollment period. During those 2 times, supplemental plans has nothing to do with it. It's just original Medicare drug plans and Medicare Advantage plans. Good question. Anybody else? All right, I'm going to move on, and feel free to keep asking questions. Oh, let's see. Are we still going to have the enrollment period for Part B, January 1st to March 31st? Great question, and the answer is yes. So, excellent question. I'm going to go back a couple slides just so we can see the dates. So the Medicare Advantage Plan open enrollment period right here, January 1st to March 31st, is also the Part B as in boy general enrollment period, and that has not changed. So excellent question. That is still going to be available. So the general enrollment period for Medicare Part B as in boy is for someone who does not have Medicare Part B and does not have credible coverage. They're only allowed to enroll in Medicare Part B between January 1st and March 31st. And there may be a lot of questions about that that I can address a little bit later, but kind of try and stick with the topic on hand. But that's an excellent question. Thank you for bringing that up.
Sydney?
Oh, thank you. Yes.
So with the Advantage open enrollment period, say the member calls in and signs up on January 31st, they want to change. Their coverage will go into effect February 1. They won't have the information. It's not going to happen that fast. But the coverage with a new plan would be effective February 1, or is there some kind of a cutoff date there? Because when you do the confirmations, it says, you know, don't even call us for 10 days.
Right.
If
so
they're
my
close
understanding,
to the end of the month.
Sorry. Yes, my understanding, and I'll get clarification, my understanding when I've just read the information that's come out on the Medicare New Handbook is yes, even if you enroll January 31st, February 1st will be your effective date, even though you don't have your cards yet. This happens a lot throughout the year with new to Medicare beneficiaries.
Yeah.
That it should show up in the system when you go to the doctor. Again, it may take some time, like you said, about 10 days before the plan even wants you to contact them about your enrollment. So we want to try to avoid that as much as we can, though sometimes it's unavoidable. But just let them know as you're counseling them, we're doing this on the last day of the month. It's going to be effective the first of next month, but you might have some lag time in terms of getting your card and the system being updated with your new insurance.
Okay. Thank you.
Great. No problem. Great question. All right. Moving on to the next new thing coming up. All of these new things that I'm talking about are going to be in effect, well, most of, never mind, I'm not going to say that. I'm going to take it back. But this is another thing that's going to be in effect January 1st, 2019. And this is a new special enrollment period for dual eligibles, meaning you have Medicare and Medicaid, and low-income subsidy eligibles or extra help, people who have extra help. Starting January 1, the beneficiary will only be able to change their drug plan or Medicare Advantage plan once per calendar quarter for the first 3 months. Now, this is very different because as of right now, in 2018, someone who's receiving assistance to help pay for their medications can change on a monthly basis. Starting January 1st, 2019, they can only change once per calendar quarter. And here's what I mean by calendar quarter. January 1st to March 31st, that's coming up a lot. It's going to be hard to keep all those dates straight. Ask questions as you need to. April 1st to June 30th, and July 1st to September 30th. Beneficiaries who qualify for extra help to pay for their medications can only change their plan one time within those periods. Notice how October 1st to December 31st is not listed. It's only going to be for the first 3 calendar quarters of the year. And if they switch, it will be effective the first day of the next calendar month. So if I enroll, like Nancy's scenario, I enroll January 31st, my plan will begin February 1st. But I will not be able to change my plan again until April 1st because that's going to be the next calendar quarter. Now, the last quarter, like I said, it's not there, October 1st to December 31st. That's because if they choose between October 1st and December 31st, their new plan selection will begin January 1st. It will not begin the first day of the next calendar month. That's the only exception to that rule. All right. I'm going to let you process that for a second. We had another question come into the chat box, so I'm going to address that real quick, and then I'll start answering questions about this new special enrollment period. There's a question that came in that says, what happens if a beneficiary wants you to run a Medicare supplement comparison and they already have a policy and you find one that's cheaper? Will they be able to change to the cheaper one? Not necessarily. So when it comes to supplemental plans, and I apologize, we're kind of going back and forth when it comes to the questions on what we've been talking about. But when it comes to supplemental plans, if you're outside of the first 6 months that you enroll in Medicare Part B and you do not have a guaranteed issue right to purchase a supplemental plan, you are going to be subject to medical underwriting if you want to change plans through a different company. Now, a little caveat to that is it's going to be easier, potentially, if you want to change a plan within the same parent company. Like if right now I'm on a Blue Cross Blue Shield Plan F and I want a Blue Cross Blue Shield Plan G, that might be easier to do and no medical underwriting than going from a Plan F with Blue Cross Blue Shield to a Plan G for Mutual of Omaha. So right now, if you have any questions on a Medicare supplemental plan, we're going to save those until the end, and I will address those. So keep typing them in. Just know I'm not ignoring your question. I'm just going to save that to the end of the webinar so we can kind of focus on the questions that are on the screen. And not to say your question's not important, and I promise I'm going to get to them, just not just yet. All right. One question came in, how will we be able to tell if when a person has last changed his or her plan? The beneficiary hopefully is going to keep good records because there's no way for us to know. Now, if we're in April, we know this is the start of a new calendar quarter. Most likely they haven't changed their plan, but if it comes June, we're not going to know. We might have to call Medicare using our backdoor SHIP number, using your SHIP ID, unique ID, and call Medicare and ask the customer service rep when the last time the beneficiary changed plans was. That would be the best advice I could give you. And for those of you who don't know what a SHIP unique ID is, if you've gone to a full two-day training for SHIP and you're currently actively counseling, meaning you're turning in monthly reports, you may be eligible to get a unique ID where you can call Medicare on behalf of the beneficiary. And if you're interested in that, email me. I'll give you more detail about that and if you're eligible. Question, how will this affect the January 1st to February 14th enrollment period to change MA plans and go back to Part D? So we're going back to the Medicare Advantage open enrollment period. The January 1st to February 14th time frame is going away. The Medicare Advantage open enrollment period between January 1st and March 31st is replacing that. So don't worry about the January 1st to February 14th dates anymore. Okay, another question that came in. So if someone enrolls September 25th, are you saying that it does not go into effect until January 2020? No. If they enroll September 30th, the last day of September, their plan will go into effect October 1st. If they enroll October 1st to December 31st, their plan will not begin until January 1st. It's only that last calendar quarter. So if you go before October 1st, you're going to start October 1st if it's in September. So for your example, September 25th, that plan, if the enrollment is complete, will be in effect October 1st. Good question. Good clarifying question. All right. Any other questions? I don't know if I have hands raised. Jane, it looks like your hand is raised. Do you have a question for me? And it may have been raised from a question you already asked. Sorry. Oh, and your hand went away. Never mind. All righty. And let's see. So it's, oh, no, I already answered that. All righty. So I'm going to move on to the next thing that we're going to talk about, which is the 2019 donut hole. Now, a lot of you have probably read in the news, the donut hole is closing in 2019 instead of 2020. We have not gotten that confirmed by CMS yet. So as SHIP counselors and staff, we are not saying the donut hole is closing in 2019. Again, not saying that. We can ask our CMS representatives if that's true. We're waiting on confirmation. We don't kind of spread the word about new things until CMS, the Centers for Medicare and Medicaid Services, has notified us that things have changed. So some sources, and they're credible sources, I find them credible sources, like the National Council on Aging and things of that, are reporting that the cost responsible to the beneficiaries in 2019 will be 25%. Instead of, if you remember, the donut hole was going to be 25% in 2020 and a little bit higher in 2019. Again, those are other sources. Be it that they are credible, they are other sources and not, you know, I like to hear things straight from the horse's mouth, as the old saying goes. So we're waiting for official confirmation from Centers for Medicare and Medicaid Services or CMS before we kind of let that go public and start advertising that. Or not really advertising it, but just letting people know. Absolutely, 100%. Once we get confirmation, we will let everyone know. We'll let our coordinators know, and then the coordinators will let all the volunteers know. And we'll cover that, I'm sure, during our update trainings for the annual enrollment period. No matter when, I want to tell you this, no matter when the donut hole closes, whether it's 2019 or 2020, doesn't matter, whenever it closes, the maximum the beneficiary will pay for their medications will be 25%. And that means for brand names or generics. Everything's going 25% when we get confirmation the donut hole is closing. That amount, the 25%, will be the amount when the donut hole technically starts. So it doesn't necessarily, the donut hole is closing, the donut hole is not necessarily going away, because once you hit a certain amount of money, and that number hasn't been released either, once you hit a certain amount of money, a beneficiary could very well be charged by their drug plan that full 25% cost. Again, more information will be coming as we get it, but I wanted you all to be aware. I remember there was one question a couple of webinars ago about this, and I hadn't heard anything. I just kind of wanted to address it this webinar and kind of let you guys know what we know. So really didn't give you any information right there, but be on the lookout for it, for emails from your regional staff if something has changed. We had a question come in. We had a couple questions come in about supplemental plans. Again, I'm going to address those at the end of the webinar, so I'm not ignoring your questions, just going to save those. You should have received from your regional staff, your regional coordinator, the new Medicare Savings Program application. I told the volunteer coordinators to send this to the volunteers by the end of last week or by the end of this week. I can't remember even when I sent the email out, but you should have received this information from your regional coordinators. If not, let me know. We'll get them to send that out. I attached the PDF versions of the application in both English and Spanish to the initial webinar email that I sent this morning and earlier this week. So you do have copies. Please, please, please delete or throw away all of your old copies of the Medicare Savings Program application. We have to start using this new one. I'm afraid if we use the old ones, they might be denied by TennCare. So if you've already sent in some old ones this past week, don't panic. Again, delete, throw away old copies, start using the new version going forward. And real quick, if I can find it. This is what you should receive. It looks very, very similar to the old application. There's a couple little changes here and there, a lot more detail going into descriptions of how you should use the application. As SHIP staff and volunteers, we only use this application for the Medicare Savings Program, QMB, SLMB, QI1, and QDWI. That is the only reason we as SHIP staff and volunteers should use this application. There are other organizations like your local area agencies on aging and disability who use this application for long-term care services and supports or the Choices program. We're going to leave that to them. They are the experts on the Choices program. We have them fill out the application for that program. we only focus on the QMB, SLMB, QI1, QDWI programs for the Medicare Savings Program. All of that means the same thing. So yes, it's more wordy, but how we use the application has not changed. You can see there's 4 boxes instead of just, or excuse me, 6 boxes, I can't count. Instead of just the 3 that we had earlier, we're only marking the Medicare Savings Program to help with Medicare costs. Now, there may be some staff on the call right now from the AAAD, the Area Agency on Aging and Disability, that do choices work. Obviously, what I'm saying does not apply to you, but it does apply probably to a majority of people on the call. So don't think I'm trying to tell you how to do your job, because I have no idea how to do the choices stuff, and I thank you so much for being the subject matter experts on it. One less thing I got to learn. So most of this is the same. Like I said, feel free to review it, and if you have questions, shoot me an email or shoot your regional staff an email, and we can go over it. The one question we always get from people who see the application maybe for the first time or don't remember all the details from the initial training, the checklist on page 8, there's a lot of things that people who are applying for a Medicare savings program do not need, like ID citizenship. We don't need that. Copies of your Social Security number, date of birth, don't need that. We don't need the health premiums. Don't need to send proof of that. Basic living expenses, we do not need to send proof of that. Phone numbers, this is my favorite one. 2 friends or relatives who can verify you are who you are. We do not need to do that. Any transfers over the last 5 years. Medicare Savings Program applicants do not have to provide that, and we do not have to provide marriage certificate. So there's about half of the checklist right there that we, under no circumstance, have to submit to TennCare. All the other things, and I'm not going to go over them one by one, but it depends on what you mark on the application if you have to send in proof. For example, if you don't have a life insurance policy, there's nothing to send in because you don't have it. But if you do mark that you have a life insurance policy, you have to collect that information. If you have more questions or want me to send you the numbers that you don't have to send in, shoot me an email, and I can send you that via there to follow up, because I still have a couple more things I got to talk about. All right. So that's a new application. So I'm going to go through these last couple slides because we are running out of time, and I want to make sure I respect your guys' time. So the next thing, super duper important, super duper exciting, Tennessee SHIP and SMP are combining forces, and we are doing a statewide volunteer conference this year. So we invite all of you, and we are going to be sending these lovely save the dates out to all of our volunteers and staff next week as soon as I get it approved. So hopefully this is approved. My boss is on vacation. So we will be having, and we hope everyone from across the state could come Thursday, October 4th in Murfreesboro, Tennessee, which I know a lot of you who are saying, holy cow, I'm in Memphis, or I'm in Johnson City, or Knoxville. How am I going to get to Murfreesboro? Tennessee SHIP will be able to provide mileage reimbursements, and if you're traveling over 1 hour away, we will be able to assist you with hotel accommodations. So we do want to try and make it possible for as many volunteers to come to the conference as you are able to. So there's a lot more information that you probably have a whole lot of questions on that we will be getting out to you. We are going to provide you breakfast and lunch on October 4th. Sorry, no dinners. It's going to be from 10 a.m. to 4 o'clock p.m. Central Time, or 11 a.m. to 5 o'clock Eastern Time. And there's the address we're doing this, the Lane Ag Park Community Center in Murfreesboro. We don't have all the details. Registration is going to be opening on August 1st, and like I said, save the dates are going to be sent out next week. So be on the lookout for that information. We're going to mail the save the dates, and we're also going to send emails out with the registration link. So more information on that to come, but I wanted to make sure you all knew and could pencil that into your calendars to hopefully be able to come and join us in Murfreesboro and meet volunteers from across the state who do all the work, the amazing work that you do in your regions, You can kind of get to know people from other regions and brainstorm on how to make the program even more successful, because we're always trying to push that bar higher and higher and higher. All right, now I'm going to open it up to any questions that anybody has. So I'm going to look back kind of through my chat box here. So a lot of these are going to go back to the supplemental plan questions, just so you know. Let's see, one of the questions came in, if you are still working with credible insurance and retire after the 6-month period, do you still have the medical underwriting or supplement when you apply for it? So if you have credible insurance and you enroll into Medicare Part B, your 6-month clock starts ticking the date that your Part B begins. So if you have already enrolled into it and you have insurance through your employer, you're going to lose your 6-month window. Now, for those beneficiaries who do not enroll in Medicare Part B because they have credible insurance through their employer and have not enrolled in Medicare Part B yet, their 6-month clock starts ticking the date that they enroll into their Medicare Part B. So there still is a possibility. It depends solely on when that Medicare Part B is effective. Let's see. We have another comment. Farm Bureau has been writing supplemental plans for brand new Medicare beneficiaries that are turning 65. Lately, I've been hearing from some beneficiaries that they are not covered for pre-existing conditions for 6 months if they have not had prior credible coverage. Is this allowed? I thought you signed up when you first turned 65, you didn't have to go through underwriting. I'll have to look into that because for the first, there may be, there is a part of a supplemental plan called the pre-existing condition waiting period. I've only read in the book that the pre-existing condition waiting period is after your first 6 months of having Medicare Part B. However, there could be more fine print somewhere that does say you have to have credible coverage before that's allowed. I'd have to look into that. It could be possible. I just have to do some more research. We had a question on what numbers do we have to collect. I'm not sure exactly what that means. That might be back to the Medicare Savings Program application. If that's what it is, shoot me an email and I can send you those numbers because I don't know. I exited the application, so I don't have that in front of me anymore. So shoot me an email on that one. Another question came in, can we still use the form that's in the envelopes that says SSA administration to help apply for LIS? There are paper low-income subsidy extra help applications out there. If you have access to a computer, it's going to be a lot easier and a lot faster to get that application approved if you do it online. I have a couple of the applications paper form for when I go out and do counseling, but I just fill out the paperwork, go back to my office, and then fill it out electronically so I can say I submitted the application that day or the next day depending on what time the counseling session ended. So the paper application for, again, this is only for the Social Security low-income subsidy extra help application. That paper application can be done electronically on Social Security's website. The application that we just saw on the screen through TennCare for the Medicare Savings Program application can only be done paper form. That is not available electronically. So when we talk about electronic applications, it is only for low-income subsidy or the extra help program through Social Security Administration. All right, Adrienne, your hand is up. The question you got for me?
Actually, it was just a comment that someone, when y'all were talking about the waiting period, and I'm not saying that this is across the board, but I've talked to a couple of different insurance companies because that question has come up, and both of them told me that the waiting period is only in effect if you didn't have insurance, if there was a gap in your insurance. So, and then they also said depending on the gap, like for instance, if it's a 6-month waiting period and you had a 3-month period where you had no insurance, then they would actually cut that from 6 months to 3 months because that's all that you were without. But if you had no gap, then there is no waiting period.
Interesting. Thank you. I will definitely, if you have any written documentation on that, if you could send it to me, I'd appreciate it. If not, I'm going to look for some written documentation on that. Just not that I think that you're lying or that the insurance company's wrong. I think that's a legitimate reason. I'm the kind of person that likes to have that in writing for if I have questions in the future.
Sydney, this is Doug. On that supplemental in the pre-existing clause, I think that you might under the old HIPAA thing, if someone's had credible insurance for the last 6 months for whatever pre-existing condition, and they select a plan within, I think, 60 days, then the pre-existing clause cannot apply. I think that's under the HIPAA.
Under the HIPAA. All righty, I will look that up as well. Thank you both. Those are great comments. And if anybody else wants to do the research as well, please let me know. But I will get looking into that for sure. I know we're running low on time, so I just want to get through this real quick. In the attached PowerPoint that I sent to everyone this morning who had RSVP'd prior to 9:30, you have this PowerPoint, and you can click the link to do the webinar survey. I will also be doing a follow-up email to everyone by the end of the workday today with the survey link in it and with the materials that we've gone over the webinar today. Will also be included in that email, so please take about 5 minutes to do that survey for us. Let us know what we're doing wrong, what we're doing good, anything to help, keep the webinars entertaining for you guys and get you to come back for more. I'll also be posting this webinar on our YouTube channel this afternoon before the end of the day, so I'll send you all an email as soon as I get that uploaded with everything. So if you were late coming on to the webinar, not a problem. I understand. Things happen. But if you wanted to go back and see what we talked about at the beginning of the webinar, feel free to go on YouTube this afternoon once I send the email out, and you can see what we talked about. So I want to thank you all so much for attending the webinar. A lot of you on the call have attended every single webinar since we started last year. So we appreciate you more than you could ever know. So thank you all again. I'm going to stop the recording, and then I can take more questions once the recording is off.